Welcome back to the channel. Today we're tackling a super important topic in healthcare, prior authorization. If you've ever been hit with an unexpected bill for a medication or treatment, you know how confusing and frustrating this can be. According to the American Medical Association, 79% of physicians say prior authorization has led to patients paying out of pocket for medications they weren't expecting. So today, we'll break down exactly what prior authorization is, why it matters, and some of the common issues that come up. So let's dive into it. First things first, what is prior authorization? Well, it's a process where your healthcare provider needs to get approval from your insurance provider before certain services or treatments can be provided. Think of this as a okay from your insurance company that the service is medically necessary, which means you're less likely to end up with a surprise bill down the road. Now, what kinds of services typically need prior authorization? Here are some common ones. Non-emergent surgeries like cosmetic surgery, which isn't urgent or medically necessary, diagnostic imaging, MRIs, or CT scans. These usually need approval to make sure that they are needed. Next up is radiation or genetic therapy. These treatments might be seen as experimental, so prior authorization is required to confirm the necessity. Remember though, each insurance provider is different, so it's super important that your doctor's office knows the specific coverage policies to avoid delays or denials. So, how does this whole process work? It's actually pretty straightforward, but can take some time. So here's how it typically goes. Step 1, request sent to the insurer. Let's say your doctor decides you need a service that requires prior authorization. They send a request to your insurance company explaining why it's necessary and wait for a response. Step 2, the insurance reviews the request. The insurance company looks at your medical history and might ask your doctor for more information before making their decision. Step 3, decision is made. The insurance company approves or denies the request based on your medical needs and history. Step 4, the notification to the provider. Your doctor's office will get a green light or a denial. If it's denied, they can either accept it or appeal the decision. Now, insurance companies usually aim to make the decision between 24 to 48 hours, but it can take some time depending on how busy they are. So, why should we even care about prior authorization? Well, there are two big reasons. For patients, prior authorization lets you know if your insurance company is going to cover the service. That way, you won't be surprised with a huge bill later on. And if the insurance company doesn't cover it, at least you know beforehand, before the service is provided. For healthcare providers, it helps streamline the whole billing process. Without prior authorization, there's a risk of delayed payments, confusion, and unhappy patients. It's all about preventing those nasty surprises. Make sure everyone, patients, doctors, and insurers are on the same page. Now, let's talk about some of the common issues with prior authorization that can make the whole process kind of tricky. Delays in care. According to 94% of physicians, prior authorization delays essential care. And if a patient is stuck waiting, that could result in a worsened outcome because they're not getting the treatment they need on time. Next up is errors in documentation. Since the process relies on paperwork, errors like misspelled names or incorrect insurance details can happen. These mistakes can delay approval and cause miscommunication. Lack of transparency. Sometimes when the request is denied, the reasons aren't clear. This can lead to confusion from both doctor and the patient, and it can make it harder to figure out what went wrong. Prior authorization helps ensure that the services you need are covered by insurance and you aren't getting stuck with a surprise bill. It's a bit of a process and can sometimes be confusing, especially with delays or errors. But staying on top of things and having clear communication, healthcare providers can manage the process more smoothly. If you want to learn more about prior authorization or the revenue cycle process, reach out to eTactics. And since you've made it this far in the video, you might as well like it, share it, and comment down below.